Correct. So one of the common contraindication, of course, many of the severe COVID infections have mild to moderate thrombocytopenia, low platelets. Now, on one hand, having low platelets and another hand continuing blood thinners is little difficult clinically, because blood thinners and these patients having any bleeding, like bleeding in the gut or bleeding from the nose, mouth, or sometimes serious internal bleeding like bleeding in the brain, can be life threatening when the patient is already on blood thinners and patient also had coexistent low platelet count. So for patients with platelet count less than 50,000, you have to devise anticoagulation smartly. Low molecular weight heparin at 0.5 milligram per kg. Normally for blood thinners to be continued, platelet count requirement is at least 50,000, but those who have less than 50,000 platelet count, most of these have, just like any viral infection inciting a hematological disease called as ITP, where body's own antibodies starts attacking the platelets and destroying the platelets. That's immune thrombocytopenic purpura, and there the blood thinners you have to devise based on the risk benefit ratio. If the patient based on the lab parameters of D dimer, fibrinogen and patient's clinical severity, you have to devise the anticoagulation. And if the patient has severe COVID pneumonia and coexistent severely low platelet count, anticoagulation with platelet transfusions is something which is recommended at these serious circumstances.